Hello everyone and welcome to the Obstetrician's View. Today we'll be looking at a topic that affects billions of women worldwide but is still largely misunderstood, largely surrounded by myths and even silence. That is menstrual health. So whether you're a teenager expecting your first menses, or a woman who is trying to understand the changes in her cycle, or a parent seeking for information, this discussion is for you. So let's begin. What is menstruation? Menstruation, commonly called a period, is the monthly shedding of the uterine lining when pregnancy does not occur. Okay, so each month a woman's body prepares for possible pregnancy by building up the lining of the uterus, and if fertilization doesn't happen or implantation does not happen, the body sheds the lining of the uterus through the vagina as menstrual blood. So this process is a normal and healthy part of the reproductive life of every woman. Most girls begin to menstruate around the ages of 9 and 15, with an average around 12 years. So let's understand the menstrual cycle. The menstrual cycle actually includes from the first day of the menstrual period to the first day of the next menses. So a typical cycle lasts about 21 to 35 days, with 28 days often used as the reference or the normal cycle length, so to say. But actually, it's a range of 21 to 35 days. So actually, there are different changes that occur during the menstrual cycle in the uterus and the ovaries. Let's summarize it into 4. So number 1 is the menstrual phase. This is when bleeding occurs. The uterus basically sheds its lining, resulting in menstrual flow. So bleeding usually lasts about 3 to 7 days. Another is what is called the follicular phase. This usually occurs after menstruation begins and the ovary starts preparing an egg for release. That's ovulation. So hormones stimulate the growth of the ovarian follicles, and one follicle becomes dominant and contains the egg that will eventually be released. Okay, the next is ovulation. So when one particular one becomes dominant and becomes fully matured, ovulation occurs. Okay, that's when ovulation is basically the egg being released from the ovary. This usually happens around the middle of the cycle. Women may notice mild lower abdominal pain around this time, increased vaginal discharge. Usually the discharge is quite stretchy, and then there are reports of increased sexual drive. The next is the luteal phase. So after ovulation, the body produces progesterone. These hormones prepares the uterus for pregnancy. If pregnancy doesn't occur, the hormone levels drop after a while and the next menstrual period begins. So a normal menstrual period may vary from person to person. Generally, the cycle length is 21 to 35 days, like we had mentioned, and then bleeding duration usually about 3 to 7 days, and then the blood that is lost in each menstrual flow is about 30 to 80 mils. There's usually mild cramping for some people, but not for everyone. So it's important to remember that not everyone will have the same pattern. Some common menstrual symptoms that women may experience before or during menstruation includes mild abdominal cramps, okay, breast tenderness, bloating, mood changes, fatigue, headaches, food cravings. Some people even have some food aversions. Okay, these are usually related to hormonal fluctuations that occur within these periods. Okay, so when are periods considered abnormal? Because menstrual irregularities can sometimes signal underlying health conditions. So you should seek medical care if you have very heavy bleeding that soaks through your pad, and you have to change probably every hour, every 2 hours. Okay, you're passing large blood clots, feeling dizzy or weak after your period, or you have very painful periods. Okay, some discomfort is normal. However, if you have severe pain that prevents school, work, or your daily activity, then it should be evaluated, because conditions like endometriosis or adenomyosis may be responsible for that kind of severe pain. Another is irregular periods. Periods that occur too frequently or are absent for several months, or generally have unpredictable timing, may suggest hormonal problems. So bleeding between periods, unexpected bleeding, should never be ignored and may require medical evaluations. So some conditions that can affect menstrual health include polycystic ovarian syndrome, which is one of the most common hormonal disorders affecting women in their reproductive ages. Usually presents with symptoms like irregular periods, weight gain, excessive facial hair, acne, which is commonly called pimples, or even sometimes difficulty with conceiving. Okay, so another is fibroids. These are basically non-cancerous growths in the uterus. They may cause heavy periods, sometimes with even very thick clots, pelvic pressure, frequent urination. They may also cause fertility challenges. Then there is endometriosis. This occurs when the tissue lining the inner part of the uterus, that's the uterine lining, is seen outside of the uterus, and it usually presents with severe menstrual pain. Pain during sexual intercourse can cause fertility problems also. Thyroid disorders are other things that can affect menstrual health. So both overactive and underactive thyroid glands can affect menstrual cycles. So having said all of this, It's important to know that good menstrual hygiene is essential for health and comfort. So some important tips for menstrual health include: change your pads regularly, wash your hands before and after changing sanitary pads, and then keep the genital area clean at all times. Use clean menstrual products and avoid prolonged use of worn pads or tampon. Dispose of sanitary products properly after use. Okay, there are a lot of myths that surround menstrual health. Let's address a few of them. Some common ones are: you cannot get pregnant during your period. The fact is that pregnancy can occur if ovulation happens early and sperm survives long enough in the reproductive tract. So whether or not you're menstruating, you can actually get pregnant. Another myth is that period must occur exactly every 28 days, like we have discussed earlier. The fact is that cycles between 21 and 35 days are normal. It is only if it is shorter than 21 or longer than 35, then we'll be talking about abnormalities. The third myth is severe menstrual pain is normal. The fact is that severe pain that disrupts daily life should be evaluated by a healthcare professional. Myth 4, exercise should be avoided during menstruation. The fact is, some exercise can actually reduce cramps. So yes, you could exercise. So away from the myths, how do you maintain a healthy menstrual cycle? It's important to know that several lifestyle habits can support menstrual health, like maintaining a healthy weight, exercising regularly, eating a balanced diet, managing stress, whether physical or emotional stress, getting adequate sleep, and then attending routine medical checkup. These measures have been shown to positively influence the hormonal balance and the overall reproductive health. So when should you see a doctor? You should consult a healthcare professional if your periods are extremely painful, your bleeding is excessively heavy, or your periods suddenly become irregular, or menstruation stops unexpectedly. If you also experience bleeding after menopause, or you have concerns about fertility, early evaluation often leads to better outcomes. So you should consult a healthcare professional. So menstrual health is an important part of your overall health. Understanding your cycle helps you recognize what is normal for your body and identify when something may need medical attention. Periods should not be a source of shame or secrecy. The more we talk openly about menstrual health, the better equipped women and families become to make informed decisions. Thank you for watching The Obstetrician's View. If you found this discussion helpful, then like, share, and subscribe. And don't forget to leave your questions in the comment section. Remember, your menstrual cycle is a vital sign of reproductive health. Listen to it, understand it, and seek help when something doesn't seem right. I'll see you in my next video.